Well, Jeff, thanks again for being here for episode 2.
This is so exciting.
This is really cool. It's fun to have some episodes rolling. We've got some really great things planned coming up. But today, I'm really excited that you're here because you have been in the community for a very long time, and you've seen the different phases of Heritage Health, not only as, you've worked with us, but also just from that lens of somebody that's been in the community a really long time. Today, we're going to talk about the Center for Healthy Living and what the future of healthcare looks like. And I get super excited talking about this, and I've had a few people say to me in the past, like, Mike, it's just a doctor's visit. Like, why do you get so worked up about doctor's visits? And this is exciting. So I think this is going to be a really fun episode. Let's talk a little bit about like how we got here and like what this is all about. But so before you worked at Heritage Health, you worked in the community, and you saw the evolution of sort of how we got started and how these concepts got there. But you were part of watching the Crocker X program sort of evolve. Let's talk a little bit about that.
Yeah. Well, from what I understand, what I saw from my perspective was Dr. Joe Abate was at the Croc Center, and he put together a program, and you can correct me if my perception's off, but he put together a program there that personal health was more than just going to an annual physical once a year. It was taking care of the whole body. It was the holistic approach. It was if the body can get exercise and proper nutrition, people lose weight, people get healthier, people need less medication. And it was really kind of a cutting edge new idea for this community, incredibly popular. And Joe really did a great job with that. And so when the Center for Healthy Living was being discussed, I was more curious. I was more interested in this. So what brought Heritage Health to come to that? Hey, look, we're going to take this Crocker X program and we're going to explode it.
Yeah, no, it's been really fun. I mean, when we were going through that phase of the Crocker X program, in our heads we felt like, okay, we've got to find a way to bring all of this under one roof. So we were taking patients out of the clinic setting, bringing them to the Croc Center, which, I mean, the Croc Center is such an amazing, beautiful space. There was something different about as you walk into Crocker X, into the Croc Center, and you feel different. You're not going to like your doctor's appointment. You're going to get healthy. And I think that was such a really cool flip. And then as we experienced that process with our patients, I remember Dr. Abate telling a story, and we'll have him on, and he can help tell these stories. But like he had this powerful experience where a patient ended up connecting with another patient about getting rides, but it was this emotional experience. Like, we've done it. We've done something really cool. And I think from that point on, that laid the foundation for the dream. Like, we know that we need to get to this spot where we have all of this under one roof, and that our approach to primary care started with that. Like, how can we build community, keep people healthy, and truly extend life? Because, I mean, that's what happens when you bring all these things together. And not only just extending life for the sake of extending it, but improving the quality of life. You know, I mean, if you're healthy, if you're feeling better, I mean, life's great when you're feeling great.
Yeah.
And it's pretty tough when you're not feeling well at all. And I think that's really the dream of it. It's been really cool to just watch it evolve. The program actually got so popular. I mean, we really had to dial it back. It just became so much to manage early on. And it's like when you find something that's just powerful like that, it sticks with you. It's really cool.
Yeah. And excuse me. I remember you talking about the concept of the Center for Healthy Living, 5 years ago?
Yeah, it's been a long time. I think we've been working.
You've been talking about it.
Yeah.
You had different locations that you wanted to build it. You wanted to build it. And you had different ideas that you wanted to do. I remember we would meet regular.
I remember posting something on social media. I was standing on a hill somewhere. It was one of the locations we were looking at. I was like, the future of healthcare is here. Yeah. And then it didn't work. I was like, duh.
No.
But it's really cool when this, so, I mean, we've started this. It's been really cool. We broke ground for the Center for Healthy Living, October, 2 years ago.
September.
And then, it took about a year, ish to get it built out. And then we moved everybody in tail end of that year. And then, people have just been rolling. It's been really fun to see it. But when we went to get to selecting the building, it was this really just funny how the universe works, right?
Yeah.
So the U.S. Bank call center sort of became available.
Yeah.
And having that pop up, I mean, it just felt like this is something really cool.
Yeah.
Well, it's a large building. It's a large investment for the organization. We had just finished our strategic planning up at, we had actually taken people up to Priest Lake and done a retreat with our board. We'd unified around what our mission is. And then this this opportunity came up. And this, like, one of the fastest board decisions that I've ever seen. It was just like, this is right. And the board said, yes, let's go explore this. I mean, it was so cool to see it.
Yeah.
And just kind of watching all of the pieces come together. So we started with phase one, and inside that phase one, you've been giving tours, but I mean, talk to me about what you've seen as you've been on tours with the community.
I mean, that you talk about that call center. That call center was 60,000 square feet with 500 cubicles in it. And when I remember walking into that building, going, "This is a big building."
Yeah.
Then when they took all the cubes out, it was like, "This is a big square building."
Yes.
And what is this going to look like? And so they took 30,000 square feet of that and created the behavioral health side of that. That's phase one. So I have been doing tours. I did 7 weeks of tours, personally inviting the community to come take a tour and learn a little bit more about the center. And what's really awesome about this place is they have taken the 6 different locations that Heritage Health's behavioral health program was at throughout the county, and they brought all 6 locations into one location. So everybody's under one roof. So you got recovery services. These are people that are coming in. Most are court ordered. A lot of kids that are coming in, getting services there. But right next door to them is therapy services, and our therapists are working with people in the community one-on-one. They've got observation areas, 2-way mirrors to observe children. And then you go across the hallway again, and you're going to psych services, and psych services prescribes the medications and those types of programs. So it really is everything behavioral health. So if somebody's in recovery service and they need to talk to somebody in therapy services, they just walk them down the hallway. It really is. It is efficient, and it's easy to use. And
there's just a real energy in that building. I mean, we've heard multiple times from our therapists and from our patients that we've had so many times in this building already where I feel like we're seeing magic happen. We're seeing, we're catching people at the right time. We have a story where one of our providers was meeting with a patient, and she finally got to that spot where she was ready to say, "Hey, I want to stop using this drug that I've been using for a long time." And wow, that's an amazing thing. In the past, we would have had to have said, "Very cool. Congratulations. We're here to support you. You're going to need to make an appointment with, this person at this location."
Right.
And the likelihood of that happening, it goes way down as soon as they walk out the door.
They fall between the cracks.
Yeah. But in this particular experience, they were able to actually say, "Oh my gosh, that's great. I'm going to walk you down the hall right now, and I'm going to introduce you to, one of the therapists and get started." And that warm handoff, there's something magic about it.
Yep.
I've also seen just the providers and staff in the building. They were, I think, 6-7 buildings, all different locations. Every building has its own culture, and you're bringing people in, and having people get to know each other, and just see it's no longer a whole bunch of fragmented offices that work with Heritage Health. We are Heritage Health, and this is what we do.
Yeah.
And to have that all happening inside the Center for Healthy Living, it's just, for me, it's a dream come true. It's so fun to see it. We've been rolling in that space for about a year now, worked out a lot of the kinks, but we're just getting started. And it's so cool to see what happens when you've got the right people in the right place doing the right things. I mean, there's an energy that comes with it.
I agree. And then the neat thing that's also happened at the Center for Healthy Living is that they've actually put a bus stop in. So CityLink can drop you off right in front of the Center for Healthy Living. So that brings us to phase 2.
Yeah.
So phase 2 is coming up here soon.
Yep.
Start breaking ground on that.
We always say soon but shortly. Yeah.
Shortly.
Yeah.
Soon, shortly.
Soon but shortly.
In the near future.
In the near future. A year from now.
Yeah. What's that going to entail?
It's so cool. So I mean, this is where, you know, the real horsepower of the Center for Healthy Living shows up. So I'm so grateful for the design team, for just everybody that's been involved in sort of mapping out what this looks like. And we that's like a whole awesome episode in itself. Yeah. But really bringing people together to say, okay, now we have 30,000 square feet left in this space. How are we going to use it? And the goal has always been to bring together the rest of our services. So we have medical, dental, we have our rapid care clinic, we have our pharmacy services, and then, you know, really looking at that community space, which, you know, the building is right on the Centennial Trail.
Yep.
It's this beautiful location. So it's called the Center for Healthy Living. So how do we design this new space to wrap all of the services in and still keep that focus on doing healthcare differently? And it's incredible. So we have a section in the corner that, I mean, it's got beautiful glass. You can see the Centennial Trail. You can see the mountains. And we have a spot that's going to be a kitchen, which is focused all about food as medicine.
Yep.
You know, what we eat really can help heal us. So helping people learn how to eat better. We'll have space dedicated for exercise and just really looking at physical fitness in a way that makes sense with our patients. So we don't have to have patients leave. And I think the cool part of that is we're not trying to just create a gym where everybody's showing up. Like, we want to teach you how to access a gym or even at home, right? You can do these things at home. But we're going to get you started, and we're always going to be there for you. And then there's some space in there that's really just dedicated to like group space, community gathering, community building. It's going to be so cool to have all this come together. We're going to be doing a groundbreaking in February and invite the community out to see that. And then it'll take, 8 months or so to get through the build. And so probably, toward the tail end of 26, we'll be moving into the space.
Yeah.
And man, just imagine what that space looks like with everybody there. I'm so excited, Jeff. That to me, it says something to the community. Like, we're here.
Yeah.
The future of primary care, of healthcare, really looks like we're here for you whenever you want. Just show up. We're going to do everything. Now, listen, there are going to be things we don't do. We're not an emergency department, so when you lop off your hand because you're trying to be handy in the yard, right? Don't bring that hand to us.
Right.
Go to the emergency department. That's great. But all the other things, really show up and we're going to take care of you. I think that is the secret to this thing, is just show up and we're going to take care of you. Also, let's do things differently. Let's think about it in a different way.
Yeah, and I know some other programs that are going to be in phase 2 is the medical.
Mm-hmm.
You're going to have the providers there doing medical. You're also going to have dental.
Yep.
And the pharmacy. And what I love about the pharmacy, and I know we've got pharmacy in Rathdrum, we've got the lockers in Post Falls, we got the pharmacy at the Coeur d'Alene Clinic right now. I love that. But what I love about that is when they're done with the provider and they've got a prescription, the provider can just call the pharmacy and say, and you can pick up your prescription on the way out the door. And because of of our pharmacy, is everyone's on a sliding scale if they can't afford it. So everyone would be able to afford it in some way, but they would be able to walk out of that appointment with their prescription. They don't have to set it up at some other off-site location, not knowing if they're going to get their prescription or not.
Yep.
But they can walk out the door with their prescription. And that's really different. I don't think that's happening a lot here.
Yeah, well, I think that's the real superpower of the Center for Healthy Living is it's all there. And then, even if you just experience right now, I think even as people coming through with tours that aren't there for a visit, it feels different. Yeah. I have a spot in that building in phase 1. There's a particular chair in the lobby that you can you can sit in and you can see everybody coming in and you can see the other side of Main Street. And I feel something really special when I'm sitting in that chair. I just feel like the years and years of history, and you go back to the founding of the organization, and that, I think we talked about it in the first episode, kind of that DNA of the organization that's just like this never quit attitude from Lidwin Durney and the volunteers. Like there's just this superpower that's like loaded into the building that's screaming out like, hey, we're here for you. Come in, you're welcome. There's something special about it.
Well, and Ledwin's there. I mean, when you first walk in the doors of phase 1, there's a big portrait of Ledwin.
It is really cool.
So she's the foundation.
Yep.
And you've never lost sight of that.
No, I mean, I think it's really cool to have that, just that focus on, we've always been here for everybody.
Yeah.
And then, building this space up to be, this is where you come for healthcare in our community. And we rely on our community partners. We're so lucky to have incredible partners in healthcare in our community. But you don't have to travel, everywhere. Right. And, we should mention, so, I mean, the goal for this, the Center for Healthy Living in Coeur d'Alene is really the pilot. And then our long-term goal is to make sure that, Rathdrum has a version of Center for Healthy Living, that Kellogg has a version of that St. Mary's has it. So, I mean, everywhere we're providing services when we think about Post Falls and all the expansion in the healthcare services that are happening out there on Prairie, what does that look like for us to have a Center for Healthy Living that's close to everybody within our service area? And, you can show up and just have this incredible experience with healthcare, which it's not always the case. And I know, we're not always perfect at Heritage Health, but just accessing the healthcare system, it's not something people generally look forward to.
Right.
Where if you've got an appointment happening at Center for Healthy Living, people are looking forward to it. It's great.
Right. You've heard me say that, provide a service so exceptional that people have no choice but to talk about you and bring their friends, that they're going to want to come back and bring their friends. And when I go into the phase 1, the behavioral health side of the center, from the customer service reps all the way to the clinicians and everybody, you get that vibe.
Yeah.
You get that vibe of, we're here for you. We want to provide exceptional service, and we want to help you. And that's always exciting to watch. I mean, even when I was doing the tours, it was always fun to run into one of the therapists, and they would take a couple seconds to talk to the therapist. And the therapists were very excited about their space and the work they're doing and the potential of that building in the long term.
No, it's been really good. And I mean, we all need to think about, how we're handling stress in our lives. And I think the other thing that's been really fun to watch with the behavioral health work we've done is really working on sort of reducing the stigma that's always been associated with mental health. Yeah. We're going to talk about that in a future episode, but we've been working really hard on that. I mean, I know you have a chaotic life and, you need lots of help, but we all do, right? We all do.
What are you saying, Mike?
I know, exactly. Well, we have to make sure we're being PC over here, but it's really interesting to watch as we talk about mental health. So I have really hard days sometimes, and my family's been through lots of chronic conditions. We lost my mom a couple of years ago. I mean, I've had really hard days, and just saying those words sometimes are really hard for people. And I think as we've really increased our focus on behavioral health across the community, we're trying to make it so that it's okay to have a bad day. Yeah. It's okay to admit that we need a little bit of help, and finding someone that can, just help you process those emotions, help you think through, what you're going through. I think it's a really important thing. And I love that about sort of being at the heart of the Center for Healthy Living, that they're in there now. We're talking about behavioral health. We're talking about substance use issues. We're talking about life is hard, and we've got people here that are going to help you get through it. And I think there's something really special about that.
Well, and I think we're in a day and age where behavioral health mental health is being talked about more. Mm-hmm. I mean, when you've got your sports figures and your entertainers talking about their mental wellness, it makes it okay. And people are talking about that more and more, and it's becoming more accepted.
Yep.
So I think that's really important, and that's where the center is going to be perfect for people coming in there now.
Yeah. Well, I mean, I think the future's looking great for healthcare in general. I mean, I'm biased because I love Heritage Health. I know you've had great experiences with this, but when I think about the next 10 years and I think about this being a tool that we have to provide for the community, I mean, I think we're in a great place.
Yeah.
It's been really fun talking about Center for Healthy Living with you. I'm so excited about future episodes. We're going to bring people in, and you're going to hear from a therapist working at Center for Healthy Living. You're going to hear, from people that have seen what this thing looks like. I mean, wouldn't it be great to have Dr. Bate on here and have him talk about that experience?
He's fun to talk to anyway.
He's great, and I promise he'll cry.
Yeah.
Like, he's so connected with this story. It's going to be great. So, I mean, the future's looking great, and thanks for being here and having this conversation with us about Center for Healthy Living. And I can't wait for everybody to see it and done. And so our goal really, I mean, we look toward the end of 2026, moving everybody in. It's going to be an exciting construction season. We'll have a groundbreaking ceremony with the community. And I mean, there's going to just be some really special elements inside this space. And I can't wait to get it rolling for the community. So
it'll be fun.
It'll be great. So, all right. Well, we're going to see people back here again in our next episodes. And I hope people are enjoying the podcast.
I do too.
You know how the first couple are kind of goofy, but I think we're off to a good start.
We're starting to settle in a little.
We're starting to settle in. It's going to be great. Well, hey, it's been a really great conversation today. Thanks again for being here. This podcast is really designed to be a two-way conversation with the community. So one of the great things about podcasts is you can leave a comment right now inside your feed. So go ahead and leave a comment. If you have a question about what Center for Healthy Living looks like, what services are there, if you have any ideas for a future episode, go ahead and leave a comment right now inside this episode. And we're going to be tracking those. We've got a great team that's going to make sure we capture them. I mean, this thing is streaming worldwide, right? So we're going to hear some amazing comments, and it'll be great to hear like everybody's take on this and what we can do with it.
I agree. And if you can leave a comment below, and if you want to email us, you can email us at podcast@myheritagehealth.org. And again, the Crackpot team will respond to you.
I think it's going to be great. So well, thanks again for being here, and really excited about where we're going.
See you next week.
See you next week. So.